1971, the clinic, as it was then known, was situated across the street in one room, and it was so successful that it just took off.
Okay, thank you. Bye-bye.
Our origins were very much with the community, that in fact it was a group of people around a kitchen table, none of whom were healthcare workers or connected to the healthcare system, who said we need to make this happen.
Community health centers have a lot of passion, they have a lot of heart and soul, they get the core issue that their value is in being part of the community, responsive to the community, and partnering with the community and individuals and families in their context, their cultures, their values, their beliefs, and their goals.
And that sort of continued through a community-based board of directors who manage and administer the program, and with regular community input, either through...
The problem with community health centers, including the North End one in Halifax, is that they're very unsophisticated in terms of the actual methodologies and tools of population health and population health tracking, measurement, accountability, and reporting. So the title of the session was, "Why Don't These Things Spread?" It's in part because they can't quantify what they're doing and measure and report, and then you can't spread because it's all heart and soul, not backed up by accountability, measurement, and so forth.
I think it is important to evaluate. I'm not saying we shouldn't, but we don't need to evaluate to prove that it works. We already know that. Do we need to evaluate, for instance, acupuncture that has been around for 2,000 years? There's no need for evaluation. It's still happening because it works, and you don't have to prove that it works. If it didn't work, we wouldn't be doing it 2,000 years later. And that's not to say that evaluating is not important. It is important, but the fact that we have 4 wonderful programs that have been going on for 30 or 40 years is proof enough that they work, from my point of view. We don't need to evaluate them to decide if they work or not. Clearly, they work.
So why hasn't it spread? I think it's because, because we work outside the box. And I get the look a lot from a lot of other healthcare providers. And that look is kind of like, you know, you're either a bleeding heart or you're special. Or I don't know how you do it.
I've got an extra sleeping bag in the van.
But what is the box and why does it exist? And what keeps the box going, people? You know, it's us. And why can't, and so we have to ask ourselves these questions.
It is an incredibly powerful box sitting there that is not in alignment with how we practice in our health center. Whether you want to talk about listening to the community or talk about true collaboration, which means there are a horizontally aligned power base, not a vertically aligned, or even this term of harm reduction where you're focusing on client goals and not your own goals. Those are all very challenging concepts which are not embraced by the healthcare system in general. And so it's exceedingly difficult to have an organization such as ours spread in the context of a very powerful community that actively works in a very different way.
If the deputy minister of a province came to see each one of you and said, listen, I'm in I just got named to be deputy minister of this province. I think what you're doing is terrific. I'd like you to make some recommendations to me as to how to implement your model in my province. So I'd like to know, if you had to give him 2 or 3 recommendations, what would they be, so that the kind of model you're describing would thrive rather than we would have this discussion of not thriving?
I would tell them to give them money and then leave them alone.
Policymakers won't be very happy with a solution that would be, just give us the money and we'll organize it as best as we can. There needs to be some form of agreements, commitments, and accountability in a democratic system. And of course, the policymakers will put a lot of emphasis on this.
Autonomy is the second principle.
But is there a risk to lose the capacity and autonomy of those models if we try to make them population-wide?
Very strongly that we have to remain autonomous in order to develop the programs that we feel we need to.
It's not easy to change power structures like that. People don't usually like to give up. power that they're given, right? I mean, that's one of the issues that I talked about enlisting physicians. Is the biggest challenge with physicians is to find people that can philosophically work within that kind of structure, because they're used to being in charge. They're trained to be in charge, and society gives them this power, as well as the medical system, and it's a very difficult thing to then find that you need to give up.
You need to develop a strong base which will be receptive to these innovations and implementing them in their context. And if we talk about primary health care, a very important component, both in terms of number of professionals involved as well as investments in budgets, is primary care, primary medical care and nursing care. And if you want these innovations to spread in those contexts, I think we also need to continue to develop those practices, provide them with tools so that they will be more receptive to those innovations. Currently, the idea or the received idea is that they're too busy to do this. So we have to help them and make room so that they would be more receptive to that.
I think there's wonderful stories about little tiny pockets, but if you can't scale it, I'm not all that interested, because at the end of the day, you have to do health at a population and scalability level, and that's what the funders and policymakers want to understand.
There's a few things on the table.
You have to convince people it has value, because doing that well costs more than the basic triage and simple treatment model costs. So if you want more investment and more capability in primary care, you have to make the value proposition. You have to sell it as being worth more, and then you have to be able to scale it to a population level. The only way you're ever going to do that is if you can evaluate it and measure it and begin to teach it and replicate it. And the only way you can do that is to get past just pure heart and soul to infrastructure, measurement, accountability, reporting, and that sort of thing. So you have pockets of excellence, you have pockets of innovation, you have some people doing some amazing stuff. Again, the best I've heard in this conference, I would say, is North End Community Health Center in Halifax. Fantastic story. But you have no measurement, evaluation, and scalability. It's all just heart and soul.
I would say it's closed. I didn't think it closed.
One of the, I guess, kind of lessons learned is when the Mobile Outreach Street Health Program was set up, there was a large emphasis placed on that particular thing, being able to evaluate it.
Things to the world, and good things will come back.
The challenge is to give enough support to these heart and soul places that they can evaluate, they can measure, they can report, and then they can start to get their story packaged into things that can be replicated other places. You can't do spread just on heart and soul.
I don't know, I'd be interested to know if any of the health centers that presented today actually have the resources, human and monetary, to do that, because we certainly aren't able to in the way that probably needs to be done or could be useful to be done.
You can't just have timid, nibbling at the edges, tweaking the car a little bit conversations. Just tinkering with the current system isn't going to fix it. In fact, the current system is designed to rapidly explode and escalate medical costs from here. As countries, we spend tons of money in coming up with new machines, new pills, and new ways of fixing and improving the broken physical body. And we spend tons of government money in this innovation and creativity of how to do more and spend more. And we spend almost no money on research and development on how to manage it and spread it and use it effectively once it's created.